Welcome to the Coffee with Cheryl podcast, the podcast for women over 50 who want to live their best life right now. Imagine having the courage to reinvent your life financially, professionally, personally, and spiritually. Join Cheryl and guests as they share practical tips and resources to inspire you to achieve the lifestyle of your dreams. So grab your favorite mug. It's time for Coffee with Cheryl.
The Coffee with Cheryl podcast. That's for women over 50 who want to live their best life right now. I am your host, Cheryl Garrison. I am an author. I'm an entrepreneur. I'm a coach. I am passionate about everything that deals with women over 50. And I'm so excited that you join me on this beautiful Monday to talk to my guest, Angela Brooks. And I will introduce her formally to you after we do our quote for today. And I hope you are having a great Monday. So let's get to our quote, and then we'll get to finding out all about Angela and what she's been doing and how you can learn about being an entrepreneur, learn about how to care for loved ones through what she's offering to the general public right now. So our quote is, the path from dreams to success does really exist. The path from dreams to success does really exist. May you have the vision to find it, the courage to get onto it, and the perseverance to follow it. We all have dreams, and Angela Brooks had a dream to help people who needed assistance with home health care. Hello, Angela. Welcome to the podcast.
Thank you, Cheryl. I appreciate you having me. You look beautiful.
All right, you do too. I love having women over 50 who come with their energy and with all that we are doing to make a change in this world after we've become this 50-something woman. Why don't you tell us about who you are and how you got here? How did you start your business, which is Angie's Angels Home Healthcare Company, or Home Healthcare LLC? Angie's Angels Home Healthcare LLC. And that is a home healthcare company, and you are the CEO and founder of this company, right?
Correct.
So tell us
Well,
about how you got here.
Okay, can you hear me?
Yes, I can. You're good.
Okay. So how it started was, as all things that I do start, feel a need, see a need, and feel it. I have been, as most women, a caregiver of some sort all my life. About the time I was 50, 55, yeah. When I was 55, I was unfortunately diagnosed with double bilateral breast cancer. It wasn't a stage 4 or greater. It was like a stage 2. But the fact that my mother, a couple years before that, was just diagnosed with breast cancer in her left breast. My father was diagnosed with heart ailments, and he suffered from that for many years. And of course, we all have family members that have to have illnesses. So I couldn't understand why a healthy person such as myself, a non-smoker, although I did smoke when I was younger, and I went out like most young girls. I went out and had a good time, but I didn't overdo it, I don't believe. So to me, I lived a relatively healthy, good life. So I didn't understand why I had breast cancer. And aunt asked me to ask myself, why did this happen? There is a reason. It's a reason for everything, which is one of my mantras. But she reminded me, there is a reason for everything. So I thought about that long and hard. And then I thought I had been on the other side of giving care. I was on the side of doing the administrative work for care for my mother and a little bit for my father. I wasn't my father's main caregiver, but I did help out. And with his wife, who is a nurse. And but I learned a lot from her, and I learned a lot from going to the Mayo Clinic and all these different hospitals and specialties, places for severe ailments. My mom lived in Tennessee, so I was very far away from her. My sister was there to care for her, but I was only able to go back in various spurts of time to go see and help relieve her. And then I got cancer. So I say all this to say, I was on the giving end of care from a relative's point of view or a loved one's point of view. And then I was on the receiving end of care. And I absolutely could not do anything for myself at one point.
Yeah.
My husband literally would pick me up out of the bed to relieve myself because I couldn't walk.
Yeah.
I couldn't breathe heavy. I couldn't sit up. I couldn't I couldn't eat because I couldn't raise my arm because it hurt so bad. Because my whole front was gone. And I brooded over it, a little while. And then I just decided I can't let this break me. And there's a reason, as my aunt said. So what's the reason? So the reason is you went through all of this education. You have all these degrees. You have always been in the caring business. You've always been a giver. That is your gift. You give and you help and you renew people. And that's what I do. That's what I've always done. So I looked into it. And at first I was going to open up a business in Tennessee because my mom lived there and I was set to go back and forth. But then the smartest thing was to open up business here in Arizona, learn all the ropes, make all the connections, make all the mistakes, and then, learn from those mistakes and then go on. So that's what I did. It's been now this month, no, July was 3 years that I actually transitioned from being a English language learner teacher and district coordinator for a district to I decided I was going to become a home health agency entrepreneur. I started looking at all of the information. I started seeing all of the statistics long before this, but it just said that you will always basically be in business. And I know, as I always tell people, you look for work where you will never be out of work and look for work that you can go anywhere to do. That's my best tidbit that I give to a lot of people, mostly young people. And I always say, never put yourself in a box. Never say this one thing I'm going to do, because as we age, we see that there are many opportunities, and the road to success, whatever success means for someone, is winding and is wide. And it just depends on where your mentality is at any point in time in life to get you to your next great adventure. So this is my next great adventure, if you will.
And there are a lot of women out there who have that thing they know that they're good at, and they're questioning whether or not they should step out and do it. And when we see women like you, it gives us the courage to go ahead and take that walk. Now, tell me, how did you get the name Angie's Angels? Was that something that you had always thought about naming your company, or how did that come about?
Well, I thought about how people perceive me.
Mhm.
And a lot of times, a lot of seniors or people in
Mhm.
need, instead of calling me Angela, they would call me Angel. And I never corrected them because I know who I am. They knew who I was, but they could never say Angela. They would always say Angel. And I thought, well, I must be an angel in some manner or form to these people because they keep referring to me as that. I looked up what an angel is exactly. It's more than just a good person. It's a guardian. It's a
Right.
caretaker. It's a caregiver. It's a protector. And then my name is, Angela, which comes from angel. So
Angel.
is it double entendre?
Right.
Um,
Mhm.
it it's a double. Angel, double angel. So my wings, if you will, are doubly surrounded by the ones I care for. So that's how it came up. It was always going to be Angie something. Um, and I just added it up that way, and I made sure that no one else had the name, and it sticks. People remember me. I get calls from all over the state, which we are statewide,
Right. Very
and
good.
yeah, and people will remember this name. It's really easy. It rolls off the tongue. And when I explain, it's our double wings around you. Angie, Angela, Angel, and that's how it came about.
Good story. Tell us, what kind of services do you provide in your home care business? Because a lot of us are, I mean, me myself personally, with my sister and her husband, we've talked about this, and the times that they have needed help. And it's just so hard to know who to call and what services are out there and how to get them, how much they cost. So tell us a little bit about the services you provide and how people can go about getting a service through your company.
Okay. Well, I tell people to ease their minds. We provide the service that you would provide to your mother, father, grandmother, sister, brother. So think of us as actually your family. I know that that's used a lot, but think of us as actually your family. What would your family do for you? So we provide extensive amounts of home care. That is anywhere from disinfecting, cleaning, organizing. Think of the structure of the home or the structure of the room or the structure of the space. So home care can be anything from the inside structure of the home,
Right.
things that need to be done, cleaning up, wiping up, sterilizing, sanitizing, cooking and preparing foods, setting foods aside for later, saving of food. It can be driving one to the doctor appointment or physical therapy appointment. It could be outings in general. I'm sure you've seen people out and about and they have a caregiver with them because that's part of the service.
Mhm.
So in a nutshell, um, I would say it's taking care of the home space. It is meals, whatever constitutes meals. It
Right.
is, it is grooming, cleaning that person, taking care of their personal, um, helping them if they have colonoscopy bags. Uh, what is the other one? I can't even think right now, but um, catheter bags,
Right.
helping them with those. Now, one thing we don't do right now at the moment is extreme medical,
Right.
um, unless when I say extreme medical procedures above simple things like sublingual injections if someone needs extra iron. We
Right.
do,
Okay.
yeah, we do things like that under a doctor's care and training and notice. We
Right.
do
Okay.
uh, give medication. We don't separate medication. We don't dilute medication or anything like that. We do change dressings and uh, of various clients' needs. So that might be yesterday I had a client, he didn't really need me to help him, but we have clients that have um, male organ operations
Mhm.
and they need help maintaining that on the first few days. We have burn victims. We have all types of people that we help them with their dressing and changing and reassessing their needs. Um, so it's home care, everything that you would think of, personally helping that person, physically helping that person, emotionally helping that person, transportation help for that person, the space that they're living in, helping them with that. Then there is companionship care. And companionship care is, as it states, is someone to come and spend time with you, to
Right.
talk with you, to help you with your day-to-day needs. It's not necessarily someone to come and cook and prepare foods, things like that. They
Yeah.
can if that's
Yeah.
added into the agreement.
Yeah. Now,
Um,
how do you get your clients? Is it through another agency that uh, sort of sources out to you, or how do
mm,
you get
we
people
get
to
clients.
use your
Well,
service?
first of all, I used to hate this cliche word of mouth, but we get a lot of clients by word of mouth.
Mhm.
And that word of mouth comes from the fact that we have outstanding caregivers that are trained and certified. We have basic caregivers, personal caregivers, CNAs, LPNs. I do have a couple of nurses on board that are contracted, patient care technicians, um, lawn service individuals, and actual housekeepers that if the client doesn't need physical care as a caregiver would give, but they need their house deep cleaned and things like that, which is not what a CNA is going to do or a caregiver. Caregivers help maintain the house and do light work. They're not housekeepers, and it's offensive to call them a housekeeper
Right.
because they've
Right.
gone to school for that. Um,
Right.
yeah, so word of mouth. I'm my registry. I'm documented on the National Provider Identification Registry. So that's national, and that is where you are registered to say, I'm a legitimate business. It has all of
Right.
your information, and it lists all of the different types of services you provide. So
Okay.
someone can go to the NPI website. I get tons of clients from hospitals, uh, outpatient surgeons, surgery, case managers,
Right.
um, community centers, churches. Um, I don't necessarily, and I won't say necessarily, I don't prescribe to having a agency
Mhm.
assisting me getting clients because for me, I have a background in marketing and advertising, and I understand the mechanics of all that. So
Right.
I don't necessarily need someone to help me get clients because I know how to get clients. And the
Right.
most
Sure.
important thing is, and I do this still, I physically make in-person calls. I contact the doctors, the therapists, um, outpatient surgeons, their offices, all of that. And those people all around the state. Those people know who we are and understand what we offer. I stay in contact with them, and that's how I get my clients.
Well, good. Now, for a woman out there who is thinking not necessarily of a home health or home care business, but who is thinking of using the skills that they have, what are some of the things that some of the tips that you would give them in starting a new venture? I know for me, just getting started with anything new, there are those obstacles and things that you confront. But
Yeah.
what are some things that were challenges to you that you were able to overcome, and you can just sort of help someone who's thinking, well, it's too hard?
Well, the challenge that I had, the ultimate challenge that I had was when I started verbalizing to people that I was going to do this. That was a challenge because a lot of people don't know your capacity, your growth, your
Mm-hmm.
ability. They only see what they see and what they want to see. And if they're
Right.
not comfortable with your growth, you hear this a lot. And I learned this many 30 years ago or more. If people are not comfortable with your ascension, then they have something that they need to work on themselves. So
Mm-hmm.
I listened to people who told me, well, you know nothing about home health care. You did not go to medical school.
Right.
And at first it really bothered me. But then I thought, but I didn't have to go to medical school to be a business owner. I've had many businesses and they're all have been successful and are successful. And when it dawned on me that I didn't have to have a medical degree or certification per se to be able to do home health. Now, home care is different because that's the medical side of it.
Right.
And I still don't have to have a medical certification personally, but the business has to have medical certifications of different levels. And
Right.
so
Right.
that was the biggest hurdle, getting over what I had never done before. And then when I broke it down to a friend who I was talking to, and I talked myself into success. After
Right.
that, I said, I have hired people, I have interviewed people, I have trained people, I have done dispatch, I have coordinated and organized. I have made speeches in front of multi-million dollar uh, companies. I have ran organizations for, I have ran organizations that were multi-million dollar organizations. And I have had charge of millions of dollars uh, of product
Right.
or service. So the thought was the most I've ever, the most I have ever managed was 30 to 50 people at a time. And then I had to look back. Most recently, I actually managed a whole school or two schools. So that's all the teachers in every school. And I thought, I've done everything but physically write a check. That's the only thing I haven't done. I have not written a check and put my name on it to pay someone. I've done it all. So after I thought about it, I was like, I've done it all. I can do it. And then you just find out the steps. What are the steps? And we live in the information age. I didn't have to pay someone to educate me. I didn't have to pay a coach. I coached myself. And I just started doing it. I just started doing it. I put everything in place. I did all the legalities first. I studied professionals who were doing very good at what I want to do. I shadowed, even though people didn't know I was shadowing, I shadowed some individuals in organizations. I just kind of, wherever they were, I was at, and whatever they were doing, I was watching what they were doing. And I picked up all the successful things up, and I incorporated those things in what I do. And I can morph positively, not negatively. I can morph, in which I have, into anything I want to be. And that's what women need to remember.
But
Everybody has a
we have all these skills. We've learned them over the years, and it does amaze me how many women, well, I don't really know how to do anything. And well, what
I
about that
mean,
job
the
that
thing
you
about
have? What about, go ahead.
yeah, the thing that I really try to instill, and especially the younger women, I am mentoring anywhere from 6 to 15 young women right now. And I don't charge because why would I? They're not at a level that they would be able to pay me anyway if I were to charge. But
Right.
why would I charge people for something that comes organically to me and I can just share it a gift? Because like I always say, there's enough pie for everybody to eat. Think of all of the medical facilities in a 5 to 20 mile radius of where you live.
Dozens and hundreds.
So you have to have a large, a large, wide spreading way of thinking and believe that you are supposed to be where you're supposed to be and that you can do what you're supposed to do. I give you a little laugh. The same way I told somebody I wanted to be a home health care agency owner, I told someone one day, I'm going to be a writer. And I became a writer. I was a writer for a local newspaper here. I was a writer for myself. I was a writer for a large magazine out of St. Louis. And nobody questioned me. I said I was a writer. I was a writer. I believe I could write. I'm good with words. I'm a wordsmith. I wrote. And there you go.
Well, I mean, you can see by my wall that I made
Mm-hmm.
that determination too, and way back in college. And you can do anything if you just put your mind to it and not let fear keep you from accomplishing it. And I just love meeting women like you who don't let people talk you out of it and don't let knowledge talk you out of it because you can always learn. And it
Mm-hmm.
sounds like you have put together a thriving company, and we all can always use more business. So she's thriving, but she can use your business. And so tell the ladies how they can connect with you if they have a need for your services. We all have someone in our family who needs. Oh, before I get to
Yeah.
that, do you take insurance, or is this all mostly out of pocket services?
Oh no. We take Medicaid, Medicare. Uh we're working on taking VA. I have some VA clients, but they have come through me through their fiduciary.
Okay.
So I work with fiduciary agencies that have other clients and they have DDD clients as well. But we pretty much take everything.
Good. So how do people contact you and find out about your services, and do you sit down with them or come visit, or just talk a
Yeah.
little bit about the process?
Okay. So the process is one, I'm pretty reachable, pretty findable. I like to say you can Google me. And in the search engines, I'm pretty high up, so that's a good
Oh,
thing.
good.
But you have to be able to Google Angie's with apostrophe, Angie's Angels Home Health Care, and you might even put in Arizona. So
Okay.
I'm the only Angie's Angels in Arizona.
Okay.
That's number one. Number two, go to the website, www. Same thing, Angie's
Angie.
Angels Home Healthcare. We're consistent.
Okay.
That's another thing to tell those that are looking to get into this business, any business. You have to be consistent. When you start making your plans, everything has to jive and everything has to be able to overlap and connect, because you don't want jagged pieces and things disconnected in your business. Anywhere from your logo to your cards to your anything.
Mhm.
But the website is Angie's Angels Home Healthcare. You can Google me. The phone number is 602-575-9005. We're on LinkedIn, Facebook, TikTok. What's the other one? All of it.
Yeah. And we will put
And
that information in the comments so that you can connect with Angie. So if you didn't write it down, just make sure you look in the comments after you look at the podcast, and all of her contact information will be there. What would you say, just as your closing thoughts to just women over 50 who want to reinvent themselves, and they're just right there and they just need that last little bit of encouragement?
what I say and what I feel, what I believe is you reinvent yourself every day that you wake up. Every day that you wake up, you are anew. You are a new you. Every day you have a chance to change your life and the trajectory of your life. You only have to take the steps. Every step is different for every person. Some people take leaps and bounds. Some people take baby steps. Some people slide. It doesn't matter as long as you start. And if you need assistance, contact someone that you entrust your heart and your baby with. They don't have to necessarily agree with what you're doing, but they need to be someone, that person needs to be someone that is not going to shoot down every idea you have. They may be critical and out of love, but they're not going to be malicious.
Right.
Mm-hmm.
And they're going
So,
to encourage you
yeah,
to
they'll encourage
and
you.
help you from some of the pitfalls that we can fall into.
Mm-hmm.
That's the whole reason for a mentor. And Angie, I'm so glad that you joined the podcast today. We've been trying to do this for a while,
Yes.
and I knew you would have so many just hopeful and inspiring things
Mm-hmm.
to share with the audience. And I'm just so grateful that you joined the
Well,
podcast.
I am very grateful. I do want to add a caveat because you asked me what's the process. Really quickly, the process is simply to call. We would either have a internet, a Facebook, or a Zoom, or a Google meeting online, or I would actually physically come to the home. We just talk about what the needs are. At that point, it's just the needs of the family, and then we can go forward from there to decide what we need to do to put in place to be able to help the family member. Then the funds come in place. How do you want to take care of it? There's lots and lots of ways to take care of home care, home health care. It's there's lots. So people should not be afraid to get help if they need help, whether it's a couple of hours or whether it's long-term care. I just want to put that out there.
Yeah. And you're all over the state, right? You
Oh
work
yes,
in
we're
the state of
statewide.
Arizona. Good, good. Well, those are good things to know. And ladies, please, if you are looking for someone to help you, connect with Angela and Angie's Angels, and they will get back with you and hopefully be able to help you deal with some very stressful times in our lives. I know my family's dealing with that, and we've talked about some things that I'm looking for a family member. Hopefully, we can get together with that, and we'll talk about that offline. But I'm so glad you joined us. And ladies, remember that this is our time. This is a time for us to live our best life, and that best life is different for every one of us. But don't think about doing it tomorrow or doing it 3 years from now, do it today. This is the perfect time to write that book, start that business, go back to college, do all the things that you have wanted to do, but you've been putting on hold. Stop the procrastination and let's live our best life right now. Thank you, Angie, for joining us today. And I hope you will come back and visit the podcast and give us an update in a few months or so, okay?
Thank you for having me. You're doing a wonderful job. It's great seeing you, and you continue to uplift those of us 50 and over. I appreciate you.
I certainly will. Thank you, ladies, and have a wonderful Monday. Hope you are enjoying your Coffee with Cheryl podcast. I know it is a privilege for me to be able to offer this podcast to you at no cost and being able to share some of the amazing women who I've had on and interviewed over the last season and starting this season. I want to share with you that this season we are offering the Coffee with Cheryl coffee mug for those of you who would like to join us on these Mondays with your own Coffee with Cheryl coffee mug. It says, "Don't talk to me until I've had my coffee with Cheryl." And we are offering these to you at cost. So you'll be able to get your coffee mug personalized, but don't talk to me until I've had my coffee with Cheryl. And if you'd like to purchase one of these, you can go to my website, 50somethinglifestyle.com/podcast, and then click on the link to be able to buy your mug. The cost includes shipping and taxes. So $25 for your Coffee with Cheryl mug. And I hope you will join me on bi-weekly for the chats with women over 50. And sometimes I just share what's on my heart with you and just have a good time chatting together on these Monday mornings. Hope you have a great, great rest of your day. And if you want to get your own coffee mug, please go to 50something.com, 50somethinglifestyle.com/podcast. Hope you have a great day.